Why do people exist?
Everyone, welcome back to Let's Talk Mental Health. Today we are going to be doing something different. I'm going to present a Prezi on the topic of depression. So without further ado, here we go. Don't forget to like, subscribe, and hit that thumbs button and notification button to be notified when we upload new videos. First, to start off with, what is depression? Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if your life isn't worth living. More than just about a blues, depression isn't a weakness, and you can't simply snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, therapy, or both. There's major depressive disorder, affects the mind, body, and spirit. There are different levels of depression. Some levels of depression are major depression, persistent depression, manic depression, or bipolar disorder. There's depressive psychosis, prenatal depression, graph photo explaining the different types of depressive disorders and how it goes. Is seasonal affective disorder, which is more than just the winter blues. Seasonal affective disorder, also known as SAD, a form of depression most often associated with fewer hours of daylight in the far northern and southern latitudes from late fall to spring. I will link in the description below one of our videos that we already did of seasonal affective disorder. Some symptoms of seasonal affective disorder is changes in weight, sleep problems, loss of interest in work, hobbies, people, or withdrawal from family members and friends, feeling useless, hopeless, excessive guilt, having low self-esteem, agitation or feeling slowed down, irritability, fatigue, trouble concentrating, remembering, and making decisions, crying easily or feeling like crying but not being able to, thoughts of suicide, and loss of touch with reality, hearing voices, or having strange ideas. Now that we talked about what is depression, we're going to talk about the symptoms of depression. They can include trouble concentrating, remembering details and making decisions, fatigue, feelings of guilt, worthlessness, helplessness, pessimism and hopelessness, insomnia, early morning wakefulness or sleeping too much, irritability, restlessness, loss of interest in things that were once pleasurable, including sex, overeating or appetite loss, aches, pains, headaches, or cramps that won't go away, digestive problems that don't get better even with treatment, persistent sad, anxious, or empty feelings, suicidal thoughts, or attempts. How to diagnose depression? There isn't a depression test a doctor can use to see if you have it, so figuring out that often starts with a thorough history and physical exam. Your doctor will want to know when your symptoms started, how long they last, how severe they are, if depression or mental illness is run in your family, if you have a history of drug or alcohol abuse. You'll also be asked if you've had similar symptoms of treatment before, and if so, how was it treated? Here are some treatments for depression. If your doctor rules out a physical cause for your symptoms, he may start you on a treatment or refer you to a mental health professional. This specialist will figure out the best course of treatment that may include medicines such as antidepressants, a type of therapy called psychotherapy, or both. There are many types of therapy available. 3 of the most common methods in depression treatment include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. Often a blended approach is used. There's CBT, cognitive behavioral therapy, a psycho-intervention that aims to improve mental health. CBT focuses on challenging and changing unhelpful cognitive distortions and behaviors. You may also see a psychiatrist, a psychotherapist. Psychotherapy is often use of those psychological methods, particularly when based on regular personal interactions with adults, to help a person change behavior and overcome problems in a desired way. You may also be placed in group therapy. As the name implies, is a type of psychological therapy that's conducted with a group of people rather than between an individual and mental health professional. Usually people in the group are facing similar issues. There are also antidepressants that your doctor may put you on, such as serotonin SSRI, which is Prozac, Paxil, Zoloft, Imanzoloft, Celexa, and Lexapro. What are the causes of depression? It is often said that depression results from a chemical imbalance, but that figure of speech doesn't capture how complex the disease is. Research suggests that depression doesn't spring from having too much or too little of certain brain chemicals. Rather, there are many possible causes of depression, including faulty mood regulation by the brain, genetic vulnerability, stressful life events, medication, and medical problems. To be sure, chemicals are involved in this process, but not a simple matter of one chemical being too low and being too high. With this level of complexity, you can see how two people might have similar symptoms of depression, but the problem on the inside, and therefore what treatments work best, may be entirely different. A prognosis of somebody diagnosed with depression. Major depressive disorder has a significant potential morbidity and mortality rate, contributing as it does to suicide and incidents and adverse outcomes of mental illness, disruption in interpersonal relationships, substance abuse, and lost work time. With appropriate treatment, 70 to 80% of individuals with major depressive disorder can achieve a significant reduction in symptoms, although as many as 50% of patients may not respond to initial treatment. 20% of individuals with major depressive disorder, untreated at 1 year, will continue to meet criteria for the diagnosis, whereas an additional 40% will have partial remission. Pre-treatment irritability and psychosis symptoms may be associated with poorer outcomes. So that's the presentation on depression. I'm trying something new. Hopefully it worked out and you enjoyed it and learned something about depression from it. Make sure to like and subscribe and hit that notification button to be notified when we upload. Thanks for watching, guys. You are not alone. Reach out and you will get through this. You are brave and wonderful and amazing. And no matter what life throws at you, you will get through whatever it is. So reach out if you feel down or low, and we will push you in the right direction to get help and get back on your feet. I've been doing pretty good with that. Like if I make a plan and something doesn't go my way, I'm like, okay, it's fine. We'll come up with another plan. Like today we weren't sure the college was open because of the stupid holiday called Family Day, but I came here after the gym and realized that it was open, so Bree came around like 1 o'clock-ish. It was fine. Everything was fine. Everything worked out the way we wanted it to.
Yeah, true.
So last week you heard about story time with me. My story is about how I don't like to be touched. This week is story time with Bree.